Today we're going to talk about pressure ulcers and how to prevent pressure ulcers on the patient. Other name for a pressure ulcer is a bed sore. So it tells us, the name of this problem tells us two things. It's caused by pressure and mostly to patients that stays in bed. But what is the other causes of pressure ulcers? It's pressure, friction, moisture, and shearing. Shearing is when the skin tears if we turn a patient or something. Because remember, these skins are soft and very frail in the elderly patient, so it tears quite easily, especially over bruised areas. So to treat a pressure ulcer is extremely difficult. The best treatment for a pressure ulcer is to prevent. That's the best treatment for a pressure ulcer is prevention. How fast can an elderly patient develop a pressure sore? How fast? No, an hour. Within an hour, an elderly patient can develop a pressure sore. There's risk factors, on the elderly patients. There are patients that's more prone to develop a pressure ulcer than other patients. The first thing is, are they well hydrated? A dehydrated patient always develops a pressure ulcer more quickly. An underfed patient, a patient that didn't get the right nutrition, will get a pressure sore more easily. An overweight patient will also get a pressure ulcer more easily. An immobile patient, a patient that doesn't walk, will also get a pressure sore more easily. Okay. So we get 4 stages of the pressure sore. The first stage is where the skin is just red, and when you turn the patient off that area, the redness doesn't go away. That's the first stage pressure sore. Sometimes it will form a blister. On your second stage of a pressure sore, the skin is broken and gone. You now have a wound. Okay? And your third stage, you will start seeing the fatty tissue. In your fourth stage of the pressure sore, you will see bone and tendons. This wound will now have a hole in it. Okay? Which is extremely difficult to treat. So, to prevent pressure ulcers, we will change the patient's position 2 hours, at least. Sometimes I will tell you to change it more often. When I see the risk of this patient is higher, like when they become sick, then the risk goes up of developing, because if a patient has fever, obviously he's going to sweat, you're going to have moisture there, which is going to add to our problem. If we're sweating, we're going to become dehydrated, adding to our problem. You see? So we want to change the patient's position every 2 hours. We want to change the nappy at least every 4 hours. When we see the nappy is wet, we change it. Otherwise, we're going to change this nappy every 4 hours. Okay. We're not leaving a nappy on a patient because the patient is dry. Okay. You change it. And when you turn a patient and you pick a patient up, be 2 people, especially if in the immobile patient. That is going to reduce the risk of tearing the patient's skin, because you won't need to hold so tightly in one spot. No. Remember, if you're alone, you've got 2 hands, you've got 2 spots you're going to take the whole weight of the patient. If you are 2 people, you've got 4 hands. The weight gets divided by 4. So already you're putting less pressure onto the patient. Remember that the patient that stays in bed is more prone to pressure sores. So therefore, we do not leave our patients in bed. We take our patients out. And we let our patients walk, because poor circulation of the blood means that the patient's skin doesn't get enough oxygen and fluid and food. And therefore it makes it more prone to break down. So a sitting patient is wonderful. It's better than a lying patient, but this patient must rather walk a little bit. You understand? If the patient can at all walk, it's better for the patient to walk a little bit. That will prevent your pressure sore. Where are we going to find pressure sores?
Yes.
Ears. And the ears, you must note, this is, you're going to find them on the elderly patient that's mobile. Or in that meaning, the walking, talking, doing it myself patient. Check every morning, check the size of the ears. Okay? Because you can find a pressure sore there easily. You will always feel the elderly patient's ears are cold. It means the blood circulation on that ear is low. Okay? We find cold extremities, the arms and the legs. It means the circulation of this patient not good. And we know most our patients are all cold, so their circulation is not good. So on the ears, ankles, shoulders, sacrum, bum, yeah, sacrum.
In between the knees.
Between the knees, be careful if you admit a patient from another old age home where they don't know what's right and wrong and they've nursed the patient on the sides, you'll find on the inside of the knees, you're going to find pressure sores there. So be very, very careful when you admit a patient from another place to check there. Yeah, how do we prevent pressure sores between the knees?
Putting the pillow.
Pillow in between the knees so that the knees, the two bony areas don't touch. Okay. On your mobile patient, where will you find pressure sores? It's a patient walking, talking, but he's confined to bed due to illness or something. Be careful of elbows. Elbows and heels, no? Because what do? They push themselves up in the bed with the elbows. No? So everywhere where the bone is sticking out, you're going to check the patient. Our mobile patients, we check them in the morning when we shower them, and tonight when we put on their pajamas, we check for pressure sores. Our immobile patients, we're going to turn them 2 hourly, we will be checking, and we will be writing in the nursing notes, we will write that the skin is still intact, no redness seen. Especially in your immobile patient. You want to write that. If you are responsible for turning the patient every 2 hours, you want to write in the report that you've turned the patient now on the right side, then on the left side, and now the patient's on the back. You want to write it every time. It's the only proof you have that you've done your job. And then you want to write there that you don't see any redness or broken skin anywhere. Because that's the only proof that you have that you've done your job and yet you have checked that the patient is still fine. Because now you go off duty and the next person comes on duty and the next person finds the sacrum is red, but you didn't write that the sacrum wasn't red with you. So it's your responsibility. Although pressure ulcers happens very, very fast in the elderly patient. It's nobody's fault, but we must try and prevent as much as possible. We can prevent it. Okay.